Kia ora everybody, good afternoon. It's good to be back. Thank you for joining us. This is, of course, my first COVID-19 media conference since the election. So before I hand over to the Director General for the regular case update, I did want to make a few opening comments. It's now 7 months since our first confirmed case of COVID-19 in New Zealand. In that time, we have learned a huge amount about this virus, and we continue to learn new things all of the time. We've made significant progress in our ability to contain and to eliminate it. We've vastly improved our contact tracing. We've processed more than 1 million tests, giving us one of the highest testing rates in the world. We've established a comprehensive managed isolation and quarantine system to halt the virus at our borders. And as you've heard me say before, New Zealand has results that are the envy of many other countries around the world. Thank you very much to the team of 5 million who continue to play their part in making sure that we are containing and eliminating COVID-19. But our success does not mean there is ever any room for complacency. Recent cases show just how difficult and tricky the virus can be and how we need to constantly stay on alert regardless of where the alert levels are at. In just the last few weeks, we've seen historical cases in managed isolation from New Zealanders who are returning from overseas. This week's cases include Russian fisheries workers, and we've seen the case related to the marine engineer who worked on the Safrana Seville. The fact that we're managing these cases while at alert level 1, it's reassuring, and it's a tribute to our robust border management, our comprehensive testing and our contact tracing. But it's also a reminder that COVID-19 is still with us and it is still rampant around the rest of the world. To remain safe, we all have to remain vigilant. So as we head into the long weekend, we have a few key reminders of the simple steps that everybody can take to continue our fight against COVID-19. First and foremost, if you are sick or you are showing symptoms, please stay home and seek medical advice. If you have COVID-19 symptoms, please call Healthline on 0800 611 116 and arrange to get a test. Healthline should be your first port of call. They will tell you where you can get a test. Everybody should continue to use the COVID Tracer app or keep some other record of their movements. It only takes a few seconds to scan in, but it can make a huge difference if you need to be contacted about potential exposure to the virus. If you can't observe physical distancing, such as on a plane or on a bus, wear a face covering. We're all used to face coverings in public now. We had plenty of experience of that when the country was at alert level 2, and there is no reason not to use them now as well. Wash your hands and sneeze into your elbow. This afternoon, all COVID Tracer app users will receive a reminder via the alert system in the app to encourage them to use the scanning system as they go about their day. I'd also like to remind all New Zealand businesses that they can play a very important role here too. The pub in Green Hive could equally have been any other business or venue around the country. So whether businesses are planning a Labour weekend sale or expecting local tourists over the holiday weekend, you all have a role to play in keeping our economy moving and keeping our people safe. So please make sure your QR codes are displayed prominently. They're easily accessible to anybody coming and going. And I particularly want to send a message to hospitality businesses. Please encourage people to scan in when they arrive at your premises. We know how to prevent the spread of COVID-19 in New Zealand. We've done it many, many times, but we all continue to need to play our part. So enjoy your long Labour weekend with your friends and your family, but keep yourself and the community safe by being COVID conscious. So I'd now like to hand over to the Director General for today's case update.
Thank you, Minister. Kia ora koutou katoa. So today we're reporting 9 new cases of COVID-19. 8 of these have been identified in managed isolation facilities, and 1 is a close household contact of one of the cases that we have already confirmed in the marine employee cluster, as we're calling it. So 7 of the cases in managed isolation involve fishing crew who are in the Christchurch Sedema facility. These were identified at day 6 testing undertaken yesterday, and I should say we do expect there may be more positive cases as the balance of the tests are processed from the day 6 testing today. The other case from managed isolation is a person whose travel involved them, originated in Iran, travelled via Dubai, and who arrived on the 19th of October. And that person tested positive following routine day 3 testing, and they are now in our Auckland quarantine facility. So our total number of active cases is 66, and our total number of confirmed cases is 1,567. Yesterday, our laboratories completed 6,053 tests for COVID-19, and the grand total of tests completed to date in New Zealand is 1,054,047. Just a further update on weekend testing available. The Auckland Metro DHBs are monitoring demand for testing closely and will further increase testing capacity over the long weekend. There will be plenty of testing opportunities available, as the Minister mentioned, in addition to 7 community testing centres open right across the region over the long weekend. It's also available in a number of urgent care clinics and general practices. And a reminder to anybody, wherever they have a swab for COVID-19, it is free of charge. Full details of the testing availability in Auckland is also available on the Auckland Regional Public Health website, including the hours of availability. And wherever you are in New Zealand over this coming weekend, call Healthline and they will be able to tell you where and when you can be tested closest to where you are. I do want to thank New Zealanders, especially Aucklanders, who are doing the right thing, remaining vigilant, self-isolating and getting tested, even if they have the slightest symptoms. Those actions will help individuals, their families and communities to stay safe. I also want to just in advance thank the people who will be working across the health system over this coming long weekend, both in the community and in our hospitals, and also in our laboratories processing the tests over the weekend. Thank you for your ongoing commitment. Just a reminder regarding the cases in Auckland, anyone who was at that Malt House pub in Greenhithe on Friday night, if you haven't already, then, or if you are a member of a household of someone who was there, please isolate and be tested. Yesterday, there were over 270 tests undertaken at that pop-up testing centre in Greenhithe, so great response there from the local community. And please stay in isolation until you receive your results. We have got in place a system to ensure that anyone who is tested gets the results back as quickly as possible, so it is causing the less disruption as possible to their weekend plans. We've had a look at the data that was sent out from the push notification to people who had scanned in to the pub on Friday night, and I must say very few people had used the app and scanned in on the Friday night. So a reminder, I can't stress enough, we have high uptake of the app. It's excellent. It's amongst the highest, I think, of countries that have got such an app. It's really useful if people use it. And so please do scan in wherever you are this weekend. The more we scan, the safer we'll be, and the faster we respond, the faster we will stop the virus spreading. Time is our friend here. Finally, just a comment on privacy and the role of the media. Yesterday at the stand-up up at the road in the Ministry of Health, I thanked the media for the role they had played in getting the message out to people who had been at that pub on Friday night. And I just want to say we've become aware of an incident where a member of the media went to the house of one of the positive cases associated with that Auckland Marine cluster twice in the last couple of days. The media rep, went to the door and spoke with a family member who was at that time a close contact, which meant there is the potential that that person from the media could be infected with the virus. The person who was at that house was self-isolating, and when they came to the door was expecting health officials to be there. Now, our information suggests that the media employee was a contact, and as a result of that, their actions may need to be placed into isolation and tested. That was our initial information. I'm pleased to say that we have reviewed the security footage from the house and established that there was a distance of at least 5 metres between the media rep and the close contact who was in that house. So thankfully, this does mean there's very little risk of transmission and the employee of the media was not at risk. However, we're also aware that media have been repeatedly contacting one of our cases, and that person has now actually stopped answering their phone. They are in isolation, our quarantine facility, but this could potentially slow down our public health response. I greatly appreciate the role that the media has played in supporting our efforts around that pandemic, but just a reminder to please respect the processes that are in place and particularly the privacy of individuals so that you can continue to support our overall efforts to contain the virus. Thank you, Minister.
Thank you, Dr. Bloomfield. Before we take your questions, I just want to reiterate a few key points about testing over the long weekend, and then I've got one other issue to raise. It's imperative that anybody who has symptoms can get a test easily and quickly, and to support that there will be over 150 sites, testing sites, operating around New Zealand for at least part of the weekend. Auckland will have 7 community testing centres that will be open across all 3 days of the weekend. We've asked DHBs to ensure in their hospitals that where there is no where there is no GP clinic testing available, that they have swabbing available in their emergency departments should that be required. We've also asked them to make sure that their websites are up to date with the most recent testing centre locations and information. And of course, the key message to everybody is first port of call is to ring Healthline and they will tell you where you can most easily get a test. Before we get into questions though, I want to take a moment to say a word of thanks and to acknowledge somebody. John Ombler has attempted to retire from the New Zealand Public Service several times before, and whenever he has done that, we have pressed him back into service. He has been playing a lead role in the government's COVID-19 response, coordinating our all-of-government effort. Today is his last day in the building. He signed off at lunchtime today on behalf of the government and in fact on behalf of the people of New Zealand. I want to take a moment to extend a very warm thank you to him. His work has largely been behind the scenes, would not have been noticed by many people, but it has been critical to our COVID-19 response. So we thank John and wish him all the best with his next attempt at retirement. Questions?
Minister, Ashley Bloomfield said that there was only a few people that signed into the pub on the night in question. Is that quite disappointing from your perspective?
Yeah, what you will have heard me say all the time is we need to stay vigilant. We need to keep using the COVID Tracer app. We have made it compulsory for businesses to display the QR codes, prominently, so it's as easy as possible for people to use it. My message to all Kiwis is please keep playing your part. It might not have been the pub, it might have been somewhere where they had been. We need to be able to let you know if you've been somewhere where someone has been with COVID-19.
We've seen those numbers.
I'll let you finish that.
We've seen the numbers of people signing in steadily start declining. Apparently this message isn't actually getting through. This please, can we keep doing it? Is there a way that the government or officials can do something else to make sure that there's a little bit more compliance?
So we'll have a very intensive campaign over the next sort of 72 hours over the long weekend, just encouraging people to use the QR code, really pushing out that message about the need to be prepared. I think one of the media headlines I saw from one of you who was writing in the last sort of 48 hours or so said we're a nation that responds rather than a nation that prepares. And I think that's probably a fair analysis of where we're at the moment. And my message to everybody is the more we prepare, the less we're going to need to respond. Barry, up to that.
The engineer who had the COVID-19, did he swipe in at the pub?
I don't actually have that information, so I'm not sure.
So this was someone who worked at the same firm as the engineer. I don't have that specific information.
Yeah.
Sorry, why can't you make it compulsory for people to swipe the QR code whenever they go into any business?
There'd be an enforcement issue with that. That would be very, very resource intensive. If you can imagine, if someone standing outside the supermarket, making sure everybody's scanning in. Someone, like every business would have to be supervising that. That would be incredibly resource intensive. I wouldn't say we would never do that. It may well be something we did at higher alert levels, but at alert level 1. I think the message is, every New Zealander should play their part here. We shouldn't need to make it compulsory for people to be doing the right thing. I think New Zealanders have shown over the last 7 months that actually we do want to do the right thing. And at the moment, my message is doing the right thing means keeping a good record of your movements. I'll come over here, sorry.
Do you have the exact numbers for the amount of people who scanned in at the pub on Friday?
I don't have the exact number, but as I've said, it was very few people. And obviously we want to shift that so that people are routinely scanning. And as the Minister said, there'll be an intensive campaign this weekend. I think we've given the message out, and thanks to you who have actually carried that message through. So I'm hopeful that we will see New Zealanders responding to that over the next
Do you think
week.
people are becoming complacent then?
Oh, I think it's as the Minister said, we quickly fall into the pattern of alert level 1, ready to, rather than responding to the threat that is there. But we've had these cases over the last week. There is an ongoing threat there. The pandemic is not going away anywhere soon. What we have done matters for nothing. It's what we do now and what we do next that really counts. The other comment I would make is this is a really good opportunity this long weekend for us to, in a sense, rehearse what we will need to do over the Christmas break. I'm sure everybody is keen to have a relaxing Christmas break and get away for it. The sooner we can do these things and lock them into our daily routines, the more likely we will be able to do it and have a safe Christmas, New Year break.
Have you seen doctors from Napier being sent over to that ship linked to the port worker who had COVID-19?
Sorry,
The team of doctors from Napier being transported to that ship?
yes, so a team of doctors flew onto the ship yesterday that's been offshore in Napier to undertake the testing. All of those test results came back negative, which would suggest that that's not the source of infection. So this was the ship that was in New Plymouth and then travelled around to Napier. The most likely source of infection at the moment, the current working theory is still that it's the Safrana Seville, which is no longer in New Zealand. But the residual risk is that is whether they picked it up off the marine, off the marine worker, and so hence the testing is an encouraging sign.
Minister, why have you already not implemented weekly testing?
I'll let you go.
Minister, are you ruling out making the app use compulsory at level 1?
At this point, we always keep reviewing everything. So, I mean, one of the dilemmas around COVID-19 is, ruling things in and out. You'll note that I very seldom rule things in and out unequivocally, because we're always looking at what we need to do, what settings we need to tweak in order to make sure our response is as robust as it possibly can be. And we look at, every day the facts change, every day the situation in front of us changes, and we need to adapt to that. But at this point, as of today, we are not going to be making it compulsory.
Is there scope for some sort of fine or some sort of punishment if people don't scan in? Or is that too premature?
One of the risks that we've seen around COVID-19, and one of the reasons I think New Zealand's response has been successful, is that we've taken an encouraging approach rather than a punitive one. The last thing we want to do is adopt a punitive approach, which means people sort of start rebelling and stop cooperating. We saw this with the issue around contact tracing. So if you start being heavy-handed with people around contact tracing, then they stop sharing information with you. On the other hand, if you're working collaboratively with them, you're working on a no-blame basis, then actually people will work really, really hard to give you as much information as possible. So I've not seen any evidence to suggest we should be adopting a punitive approach. Actually, the approach we've got now works quite well. Mikey?
Your thoughts on that issue, Dr. Bloomfield, because you've spoken about the fact that the virus isn't going anywhere. Is it sustainable to continue on with this sort of encouragement and high trust model, or do you think there will come a point where we do need something a bit, more tangible than that?
So I'd like to pick up on your comment around high trust, and I think this picks up on what the Minister said. Actually, we have been successful to date because of a high trust arrangement, and in my mind, because people have had done these behaviours before, they have scanned regularly, they have used masks on public transport and on flights. I feel confident that if people see the benefits of doing that in alert level 1, that they will again take up those behaviours. And so many public health interventions rely on high trust and a sense and encouragement. And another good example here in New Zealand is vaccination. Most people, especially if they have good information, will actually be vaccinated or vaccinate their children. And I think this will continue to be the mainstay of our success and our response in alert level 1.
So why have you not already implemented weekly testing of high-risk port workers?
No, they are being routinely tested. It typically is fortnightly for those higher risk port workers. I do just want to say a word about port workers. What we've seen is the number of port workers being tested has been reducing. And one of the reasons, and I've been looking very closely at that, and one of the reasons for that is that the ports are taking active measures to limit the number of people who might be at risk. So, for example, the number of stevedores and pilots going onto a ship, they've been narrowing that down to a very small group rather than having a large group of people going onto ships when they're coming in. So those testing numbers are going down, but that's for a good reason, because they're not exposing as many people to a likely risk. The number of thousands of people interact with our ports up and down the country every day. The proportion of those who are at risk of exposure to COVID-19 is actually a relatively small number, and those people are being tested regularly.
So various public health experts have told us it's shocking foreign ship crews can changeovers can fly into the country without being tested or needing to isolate before getting on their vessel. Why is this still permitted?
So we've been looking at that very closely just in the last few days as a result of the most recent issues we've been dealing with. Those who are staying in managed isolation, so who are stopping at the airport or near the airport and staying for a period of time, will now be tested. That will become a requirement for them. There are occasions, though, where people are flying in, they are transferring directly to a ship and then they're sailing out again, and testing would delay that process. The risk there is very, very low, and so testing them wouldn't necessarily add anything to our protection. But where they're stopping for any length of time, even if it's just an overnight stay, we will be making sure that they are tested.
How many empty?
That Auckland port workers bordering the Sofrana Seville and were subsequently never contacted by public health to get tested. You say our systems are robust. This doesn't sound robust at all, does it?
So look, we'd have to look at that. My understanding is that there have been good records of everybody that went onto the ship, that all those people who have gone onto the ship have been contacted. One of the things that there were in discussions about, and that the ports are actively discussing themselves, is whether there are further things they could do to speed up that process. For example, should every new ship that comes into port be issued a QR code that applies for the time that they're in port. Now that would speed up the process somewhat, but my understanding and the advice that I have had is that good records were kept of people who went onto the ship, and that those people have been contacted, but I'll ask the Director General if he has anything to add.
That's my information too, Minister. I think the Public Health Unit moved swiftly, worked with the port and the owners of the ship to identify anyone who had been on board, including pilots, the exact stevedores and anyone else who had visited the port. They were stood down, tested and remain treated as close contacts for the time being.
Why hasn't the
Come back to
government
Barry.
taken-
I think I heard you booming up the back, Barry.
How many empty beds do we currently have in managed isolation?
I might have those numbers here. I've got the latest daily sheet on those. We have a vacancy rate. At the moment we've got our current occupancy is 4,962, with a current capacity of 6,261.
Who's paying for those beds?
Well, we are, obviously, but bear in mind that that doesn't necessarily tell the full picture. For example, when we get a positive COVID-19 case, those rooms aren't all immediately reoccupied. We do have to preserve some capability here. Some of the vacancy rate will be based on what we're expecting to be incoming. So we are better forecasting now, and we're continuing to improve. I'm not managing this, I'm not the Minister managing this at the moment, but the forecasting work that Dr. Woods and her team have been doing is helping us to better predict when we're likely to see people coming in, so that we can manage our managed isolation facility capacity to its fullest extent, but we will always need to be carrying some vacancy rates, because from time to time we do need to accommodate people at short notice.
Sorry, you just said you're the Minister not managing this at the moment. Does that mean that you'll be managing it in the future?
That was a very nice try, but you'll just have to leave that one to the PM.
Not of that, but we've been told that there's potentially another outbreak in West Auckland. There's amongst the Pacific community, there's sort of may have gone to churches and that sort of thing. Is there any truth to that at all?
Look, I'll ask the Director General to comment on that. I've certainly not been alerted to anything that would be consistent with that.
No, there was some rumours circulating last evening, but I can say that that's not the case.
Why hasn't
We'll come to Joe up the back.
Just talking about the forecasting before, for the most part, is the expectation that those numbers will drop off and continue to drop off? Because most people who were going to choose to come back probably would have by now, wouldn't they?
So we are... There is a ministers group that are coordinating this, and one of the things we're looking at is, because of course in addition to New Zealanders returning, we also have essential worker exemptions coming in, and so if the number of New Zealanders continues to decline, then obviously we'll be looking to fill those spaces with other essential workers coming in. So you've already seen exemptions for a range of essential workers, for a small group of international students, for example, PhD international students, about 150 of those. We have got a prioritised list that we're working our way through. We're still working through the prioritisation process, but our intention here is we'd still want those managed isolation facilities to be operating at a reasonable capacity, bearing in mind we have to carry some vacancy. And if we see the demand starting to tail off from New Zealanders returning, then we'd be looking to fill those spaces with others.
Right, so there isn't a situation where you start to close some of the hotels down in areas because there's no demand. You will just find other people to bring in.
Look, there is huge demand at the border. Up until now, most of our space has been reserved for those returning, New Zealanders returning. If pressure starts to ease in that area, there's still demand in other areas, and we'd be looking to tap into that to make sure that we're allowing people to come into the country. So we're seeing more people, for example, who may have been on work visas who had been based in New Zealand. They weren't included in that returning residents and citizens category. They are a priority for us to allow them to come back into the country as well. So there are a variety of other groups that we'd be looking to make sure we're facilitating back in.
Lastly, with your education hat on that, talking about international students, where are things at with that space? I mean, what sort of numbers can we expect to see come through?
So we've approved 150 PhD students at the moment. Obviously, it's going to depend on capacity to manage isolation at the border. We do want to allow for more international students to come back into the country as we are able to do so. But I think as you've seen, even with the fisheries cases that we've been dealing with this week, the idea that we can just start popping up a whole lot of new managed isolation facilities without increasing the risk, I think that's something that we've always been aware. Whenever you expand capacity, you increase risk. And we manage that risk very, very closely. You've got a question over here. You've been waiting very patiently.
Why hasn't the government made masks compulsory on public transport in Auckland when the majority of people clearly aren't following the recommendation right now?
Look, at alert level 1, our view at this point is that it's not needed, that we don't need to make it mandatory. But that's one of those things that we always keep under review. I wouldn't ever rule it out, but at this point, we're not going to do that. That would be a decision that I wouldn't make individually as a minister. It's a decision that the whole cabinet would make. Oh, sorry, yeah, come back.
We spoke to a patron at the Greenock pub who told us that he would not get tested even after being asked by health officials. What can the ministry do about that?
I invite the Director General to comment on that.
I can personally appeal to him to go and get tested, please. It's not something we can do compulsorily, but what I would like to say is that many members of that community have clearly been tested, and I want to thank them for their response, and I hope that this person will also play their part.
So just
when you're talking to
Well, let Mikey come up the back
do you
here.
think people like that should be made known to authorities, and should they be kept an eye on in terms of whether or not they are self-isolating and just not posing any further threat to the community if they are refusing tests?
I think what I would say is our success to date has been because everybody has done their bit, and we have shown that through our collective efforts we have done really well, and we want to continue that. So I can just, every New Zealander needs to do their bit.
But when there is a blatant refusal to get tested, should they then be sort of put under the microscope, made sure that they're not you're just walking around perhaps, infecting others?
Yeah. Well, we do have options to require people to go into isolation and or be tested if we feel they pose a risk, and that would particularly apply to people who were close contacts, known close contacts of existing cases. For the very most part, we don't need to do that, and we've seen a really high degree of support and cooperation from people to date, and we'd like to see that continue.
You said you personally reach out to these persons. I mean, what sort of, would it be like a good cop, good Ashley, bad Ashley sort of thing? Like, which would you be more sort of bringing down the hammer, or more sort of, hey, do this for the community? How would that conversation go, I guess, is what I was asking.
Well, I don't know who the individual is, but I'm just saying, actually, anyone who hasn't yet been tested, including this person, please do your bit and go and get a test and isolate till you get the result. We will get the result back as quickly as possible. If you're bothered about having the swab, I've had one myself, I think the Minister has, and it's bearable.
All right, I'll be the bad cop here and say last couple of questions. Barry.
Would you like to stay on the health roll?
Nice try.
Do you have a preference?
It's ultimately a decision for the Prime Minister. It's an enormous privilege to be a minister of anything, and I'll leave all of the comment on that to her.
Over the weekend, you secured the highest margin in the country in your electorate seat. How does it feel being essentially the most popular electorate MP in the country?
Look, I'm very humbled. I welcome the support of the local community, and it is actually an incredible privilege, and I don't take that lightly. And, being a member of Parliament is an enormous privilege. Being a minister in the government is an even bigger privilege, and it's not something I would ever take for granted.
Prime Minister.
You had a question here?
I was just going to say, on the back of that, it's been a long campaign. Do you have any plans for the Labour weekend?
A bit of time with the family, actually. It's my son's birthday was last weekend. Not great timing, so we're going to do his birthday this weekend.
On the official inquiry into the country's response, could you just make some comments around that, please?
Look, I think we've always acknowledged that at some point it will be an appropriate time to have a proper, thorough inquiry. For now, our focus is on continual improvement, so we're always looking for how we can improve things. But I don't want to distract people who are absolutely focused on continuing to respond to COVID-19 from that very critical job while they're still doing that. So at some future point, whether it's a Royal Commission or some other, formalised review, that will happen, it should happen, but we're just not at that point yet. We still need people firmly focused on looking ahead and making sure we're doing everything necessary to respond to the challenges in front of us. Amelia.
The New Zealand Institute of Safety Management is proposing an immediate task force to develop improved protocols alongside WorkSafe to help maintain the health of workers at risk of COVID-19. Is that something that you would support, or what are your thoughts on that?
Look, need to look at that some more. Obviously, we're always looking at where workers may be at risk, wherever they're working, and looking to minimise that as much as possible. WorkSafe have a role there. The Ministry of Health, of course, play a very active role here, as do public health units. So we're always looking at that. So we're looking at the border workers, we're looking at those who work in managed isolation facilities, constantly looking at our infection and prevention and control practices. So one of the things that the Director General commissioned not long after I became the Minister of Health was a review of the infection prevention and control in all of those managed isolation facilities, so we could identify areas where we could do things better. And we always learn as we're going along. So, for example, you may recall several weeks ago now, may have even been longer than that, the issue of the wheelie bin, where we've identified an area where we can continue to strengthen and tighten our infection prevention and control. So we're always looking at those things.
Going back to port workers, you did mention we're being tested frequently, but why aren't they being tested weekly as opposed to fortnightly?
It's based ultimately on a risk assessment. So at the time we put that system in place, the risk assessment was that fortnightly would be appropriate. Risk assessments, by their nature, are always being assessed. So you're always looking at, okay, have we got that right? So we will always look at that, and we'll consider whether or not some people who are tested fortnightly need to go weekly, and whether some people who are tested weekly need to go fortnightly. Those are things that we're always looking at. But at the moment it's fortnightly, but we keep that under constant review. And again, I'll ask the Director General to comment on that.
Look, I think another relevant comment here, Minister, is that the testing is just part of the arrangements in place to protect the workforce and also protect the border. So there's use of PPE, there's physical distancing, and a range of other measures, infection prevention control on vessels, restricting movement around the ports. All these things are part of the package. This latest case gives us a good opportunity to look at that end to end and see, are there any learnings, and therefore what else might we do to strengthen the border. It has served us very well to date. This is the first time we have identified an infection coming into the community from a ship since the COVID outbreak started.
How are we feeling?
Ollie, you have the second to last question, and you can have the last one, okay? There we go.
I was going to say, but as a safeguard, should we be making it weekly?
Look, as I said, we keep that under constant review. I'm not announcing anything on that today, but we always look at those things.
And how both of you feeling about this outbreak? Is it still well contained in your eyes? Are we sort of at a green or amber level? Sort of, what are we?
Oh, look, I'm sure the Director General will have thoughts on this. I get briefed on cases every day. And at this point, I stay awake at night thinking about them all, regardless of where we're at. But at this point, this is not causing me heightened levels of anxiety, but then just the more sort of the usual levels of anxiety. But Director General.
Thank you. I won't comment on my levels of anxiety, except to say that we have a team, a cross-government team, National Response Leadership Team. It's been meeting daily, and we met just this morning again to look at the latest cases, the pattern, and where things are at with contact tracing, and feeling comfortable that at the moment alert level 1 is certainly the posture we need to be in, and all the signs are, a week on from when we detected this first case, that the outbreak is well controlled, and we can hope to continue that, and we will keep you updated on a daily basis.
All right, we might call it a day there. Thank you, everybody. Cheers.